Oh, good evening, everybody. They caught me by surprise there, but I'm Dan McKee. Welcome to Community Conversations. Tonight is our last program for 2020, so we're reflecting on 2020 and what that's meant to us individually, personally, and professionally. And we're all certainly have had a year to remember. And tonight we're going to be focusing on our healthcare heroes. The people who are representative of thousands of people in the state and around the country that are front and center on taking care of us and providing us with the care that we have all needed, and also to provide us with the guidance on how to be safe during the COVID the pandemic, and also how do we can make sure that which I believe right now we've got the vaccine issues, and that's going to bring its own challenges. But this is the time to really pay close attention, right? Whenever you have to, end out something, whether it's a game or an effort in terms of your business or your family, as you get close to that goal, that's the time to really double down and really put more effort in to make things happen. And the intensity that needs to be put in right now by all our communities. Everybody lives in the state of Rhode Island to be safe, and doing everything we can to be safe. This is the time to really do it. I've heard about COVID. The kind of the loss of attention, or just is worn us down, and we got the fatigue. And no, this is not the time to be fatigued. This is the time to really pay attention and finish it off strong, so that we're safe as we enter the vaccine and beyond that, in terms of what we need to do to restore our economy and our health. So I want to just thank everybody for being here. My reflections on 2020 is that we're challenged, not only health wise, but also by economically and education wise, right? So I've always used this opportunity, because I've been involved with education really front center as being a really important issue for us as a state before the pandemic. It's doubly important right now, because we've had virtual learning in our schools now for close to a year. We've had hundreds of hours of lost learning that we got to figure out how to provide that lost learning and make up on that lost learning for our students that live in the state. And it really doesn't matter if you're coming from a high income, low income, moderate income, minority, non-minority, urban communities, suburban community, if you're in private school, or you're in public school, or a charter school, or a mayoral academy, all our students have lost hours, and our the different schools, the different districts are doing everything they can to make it work. So we can't expect that they're going to be able to to fill in these lost hours unless there's an intentional strategy. So I'm proposing that we look at what I did as a mayor in Cumberland with a municipal education department. We run a 52-week a year. We have retired teachers, underemployed teachers doing math and reading and science and music and robotics and from pre-K all the way up through high school. If we opened up something like that in every community, we'd be able to do a 52-week a year effort to intentionally catch up on this learning time. It'll make a significant difference. I know it has in the town of Cumberland. We'll start our 15th year under our third mayor, Mayor Murray after me, and then Mayor Mutter after Mayor Murray. Have established this education department and has made it work really well. So that's that position. And then the last piece that I'll say before we go into the healthcare and introduce our guest is on the small business issue. When the president signed the legislation on Sunday, that extended the CARES Act funds, the $1.25 billion that was provided to the state of Rhode Island with federal dollars to help combat the virus, both on the health issues, respond to that, and also on the economic issues. Funds in that CARES Act could be allocated to grants to help small businesses. Well, the good news is that we can carry over the dollars into 2021, the dollars that weren't used. So, for instance, when we did the pause grant, which was for the businesses that were asked to shut down right after Thanksgiving, our restaurants, our gyms, and other related businesses were impacted in a way that made it difficult to do business. They were able to receive grants for that, but $70 million in that case was appropriated. Maybe a little more than half has actually been allocated. So there's tens of millions of dollars available there. I'm saying let's carry those over and help our small businesses in a kind of a Restore Rhode Island 2, like a version 2. Get all the businesses that have been helped already and all the businesses that weren't able to be helped. Those dollars rolling into our state right now, into our businesses, it's good for our economy and it's good for our health, because a bad economy impacts our health, and you're going to hear about that tonight. But that's what I would say right now. Let's count our blessings. This is a time to count our many blessings as we, end the year, coming through the holiday seasons. But we want to be sure we're safe. And tonight we want to really recognize and honor those individuals that have been on the front lines trying to keep us safe. So, Ben, please bring on Cliff Cabral from BH Link, and then Brian Kwetkowski from the Family and Primary Care Physicians. Raquél Lynn Pérez is joining us, and Raquél is a ICU nurse at Women's and Infants, and Noah Benedict, who is the CEO of the Rhode Island Primary Care Physicians Corporation. Welcome, all of you. I really appreciate you taking the time tonight to come on and to talk about health and safety and the roles that you've played, and all the people you represent, because you represent thousands and thousands of people that have been on the front lines really working hard. So let me just start with Raquél. We've said that she's had the best backdrop with a tree there, so we're gonna start with her. Introduce herself, and also thank you for being here. Give us just introduce yourself and give us just a little bit of overview of what the year personally has been to you. In terms of the work that you've been involved in, and all your colleagues as well. But welcome, Raquél.
Thank you so much. And clearly, I still love Christmas, which is why I have my tree up. I feel like this year we need all the joy we can get. Thank you. First, I just want to say thank you so much for having me on this panel. Certainly, there are a lot more seasoned nurses, and I'm sure a lot more nurses that have experience in the direct front line. So I feel very honored to be chosen to speak. So as you said, I do work at Women and Infants Hospital in the McKee, the neonatal ICU. Prior to that, I was working on a unit where we did see COVID patients. And currently I do work per diem as a COVID response nurse, meaning I do swab patients in the state. So I have had a bit of touch and go with COVID. Certainly, I would say my experience is much different than the bigger hospitals in the state with larger emergency departments or ICUs. And I mention that because I think it's really important to put into perspective. But I think this year overall has really highlighted, at least for me, the importance of nurse advocacy. And that's been my prioritization personally, because once COVID hit, I felt there was a call to action to make sure that myself and my colleagues, other nurses in the state, were really being listened to. We all know that there was a shortage of PPE throughout the entire country, and that really affected not only myself, but friends and colleagues. So I found it really important to take it upon myself to speak about this in whatever way possible. And I'm proud to say that I sit on the Rhode Island Nurses Association board. So I'm trying to advocate in that way and just be part of a movement forward and educating people, not only about what nurses do, but just on the virus itself. So thank you again.
Yeah, the advocacy piece, I would mention about Cheyenne in our office, and Cheyenne was, a URI grad a few years back, and she's been really instrumental in advocating on some issues that related to women. You actually were on a group that was, training and learning on how to be an advocate, right? Over the last previous year, 2019, correct?
Yes, I was part of
too. How did that, that experience help you in that advocacy that you're talking about right now?
Yeah, so part of the Women's Fund of Rhode Island. One of their programs is the Women's Policy Institute, which I was in the cohort with Cheyenne. That's how I met her. That program really taught me the importance of speaking up for community and knowing your resources. It opened up my network tremendously. We had incredible guest speakers come in who have ties to policy throughout the state in different aspects. So going through the program, like I said, it really just highlighted the advocacy part of my passion and wanting to make sure that everyone is counted and has a voice and a seat at the table. I find that incredibly important, and that really does stem back to my background. I was an AmeriCorps member after graduating from the University of Rhode Island, like Cheyenne, ironically enough. So, you know, everything just came together with my profession, with being in the Policy Institute, and it made sense. And so now I am sitting on the board for the Nurses Association, advocating for policies that matter, like getting PPE and getting nurse rights.
Yeah. So I think, you know, the advocacy, sometimes people shy away from it because they feel it's conflicting. But, you know, the time frame that I've been in, you know, public office, and before, when I was doing my volunteer work as a board member of the Boys and Girls Club or something like that, it really is important to, you know, to be advocating and understanding that it's that you know that there's a certain level of compromise. But unless people hear from you, you know, Raquél, unless they hear the story, then how are they going to evaluate whether it, you know, how it fits in terms of the overall policy in the state? So thank you for, you know, coming on tonight, and we'll talk a little bit more about what's happening, you know, in your field right now, but also during the year. Brian, help me out a little bit here. Introduce yourself and let us know, you know, give us a little bit of background on your work, but also, you know, personally and then professionally, what this past year's experience has meant to you.
My pleasure, Lieutenant Governor, and thank you so much. You know, I'm honored to be here also speaking for frontline workers. I mean, nurses like Raquél, the hospital doctors and nurses, the walk-in doctors and nurses, the nurse, the school nurse educators, the walk-in centers, everybody, the outpatient physicians. Everybody's worked so hard during COVID. So it's an honor to be here to provide some information for the public. My name's Brian Kwetkowski. I'm a primary care physician in East Greenwich. I also serve on the board for Rhode Island Primary Care Physicians Corporations and Integra Community Care. I also serve as a school physician, which was a particular challenge this year. I'm the school physician for the town of Johnston, and I also serve for the Johnston Police Department on their emergency task force. A lot of those titles have been, you know, interesting, but this year they were all activated. So they were, it was a lot of work this year. You know, outpatient wise, being a primary care doctor was very difficult. We were shut down like everybody else in March. We had to make a decision how we were going to participate and help with COVID-19. We embraced it. I mean, me and my partner, Dr. Del Sesto, were in the office every day and learning what we could learn on the phone with our patients all day, booking tests, talking about quarantining and isolation and their partners, and basically, monitoring patients to see who needed to go to the hospital and needed a higher level of care. It was all very interesting. As time went on, the Rhode Island Department of Health, you really have to give them kudos. Dr. McDonald started doing a weekly, then bi-weekly education session that's still ongoing. I've never missed one, and it's really been invaluable. And all the providers in the state have been able to learn together and really help with, treatment of COVID-19. The school physician side of it was another challenge. I've been a school physician for 19 years. It's certainly been more interesting this year than any previous year, but it's been fantastic. That people really need to understand the hard work, the administration, the school nurses, the teachers, everybody works so hard to help have these students have some form of in-person learning. And I think we did a great job getting a fair amount of in-person learning and improving our distance learning in the state. So it's all been just a fantastic learning experience.
And on the school issue, and then I want to get back, we could go around the people here and open it up after everybody gets to introduce themselves, Doc. But the schools play an integral role. And as I was saying in my opening comments, it's the safety issues, the school issues, the economic issues. So they're all interrelated. The rollout right now about, our teachers, our students, our staff there at our schools. I still serve on a school board with the Blackstone Valley Prep Merrill Academy. I hear from, we have our board meetings. We hear about the challenges that the schools have, and the conflicting, decision making that goes into figuring out how to keep our students safe, but also our teachers safe. And you got the vaccine coming up, and hopefully, are you getting any thoughts about, how that might, has there been any information that talks about, getting our teachers feeling safe? Because if they're not feeling safe, we're not going to have the kids back in school. And, you're dealing with that, a very important issue right now. I didn't realize you were working with the Johnston School Department, so thank you for that. But yeah, give us a little overview of, the not only the vaccine issue, but the challenges that you've had, the real life challenges you had that, to open up our school.
Oh, absolutely. I mean, there were so many meetings with the administration, with the nurses, with RIDE, with the Department of Health. Some of these Zoom meetings had so many people on it. It looked like a giant episode of the Brady Bunch on my computer screen. But a lot of people worked so hard to get the schools open. And I think it was very well planned. There was certainly a lot of angst. I mean, right up until the day we opened, it was, all right, what do we do with a sick child? Even though we had discussed it a dozen times, it's still, once it was in front of you, what do you do? And it was, it was a lot of communication. I mean, I took a lot of calls from school nurse educators early on. And as comfort started to grow, I found that, everybody was handling it, pretty mainstream and pretty well. I'm proud of the fact that Johnston didn't close until, December. So, I think they did such a fantastic job. And I hear most of the towns were in the same boat. The vaccine's another whole story. The vaccine's really important. I agree with you. I think, I think the teachers and the school nurse educators need to be high on a list. It's the best way there's a lot of angst, a lot of anxiety. I think they really need the vaccine. What I'm hearing, and again, I don't want to be a quote for the Department of Health, was that they kind of got moved up the list. And I don't think it'll be too long. I think the school nurse educators will be first. But I don't think the teachers are far behind. I think they might be in a stage 2 type program. But again, we can check with the Department of Health on that and see if that's the case. I can't wait until they're all vaccinated. I think it's great.
Yeah, so we'll get you in touch with some people that I've been working with, both on the national and the local level, that are, they're going to be front and center in terms of the strategies of doing the advocacy that Raquél was talking about, on behalf of the teachers, so that it's really understood how important they are in this whole mix. The health, the schools, and the economy are all interrelated. So so I'll be looking forward to sharing some of that with you, Doc, some of that information, and also hearing firsthand the work that you're doing. So thank you so much for being here tonight. Cliff Cabral, please introduce yourself.
Good evening. Thank you for having me, Lieutenant Governor. It's my career has really been spent in behavioral health for about 30 years or so. I started out as a frontline worker at Bradley Hospital, working with children and families long time ago, and became a licensed therapist, worked in private practice for much of my career. Most recently spent time as a home-based clinician before getting into more administrative duties at developmental disabilities and behavioral health organizations. And this year I became the CEO of Horizon Healthcare Partners, which consists of 3 community mental health centers, including Newport Mental Health, Thrive Behavioral Health, Community Care Alliance, Kodak Substance Abuse Treatment Centers, and Tides Family Services. So we really run the spectrum of behavioral health services and family and community-based services for individuals across the state. This year, I started in one position, working in congregate care settings and day program settings with individuals with developmental disabilities and other populations, and then transitioned into this role, which is consists of really a wide range of behavioral health services and human services across the state. But in particular, perhaps one of the most highlighted is the BH Link, which I know that you and the governor have supported and talked about quite a bit recently. And that is a triage center that essentially is there for all Rhode Islanders as a one-stop shop and really an entry point for access to the broader behavioral health community. So we triage, we provide assessment and direct service in a crisis, and we also navigate care to other services across the state, whether it be within our own network or outside of it for either medical or behavioral health care. In terms of what this year's been like, it's been a wild roller coaster ride. I think it's been a lot of ups and downs, a lot of reacting to the human toll, the financial toll, the human resource toll that this has taken on us as health and human services providers. And really what's been extraordinary is that, I'm honored, as others have said, to represent frontline workers. It's been a while since I've been on the front lines, but I can tell you that there's no other group better prepared across the healthcare spectrum to deal with this pandemic, and their courage and their response has been extraordinary. That said, they're human, and certainly there has been a human toll that I'm sure we'll discuss as we go on here.
Yeah, thank you for speaking to me last week too. We had a good conversation. I tell you, this is a two-edged sword. The fact that we can do these, expanded Brady Bunch strategies, as the doctor saying, because I tell you, our schedules, and I'm sure yours is the same, is absolutely full. There's no such thing as I got to travel to my next appointment and just calm down for 15, 20, 30 minutes. Between it's back to back, Cliff. So thanks for coming on the other day. And I do want to explore some of the the things that you're facing right now, and during this call, and also let people know if they were having experience with some of the issues that you have a service, how would they contact the BH Link? Do you have that information?
Yeah, the general phone number to the BH Link is 401. That's our area code in Rhode Island, of course. 414-LINK or 414-5465. And that's a 24-hour hotline that you can call, at any time. There are other lines that we manage, including the National Suicide Hotline. So if someone's calling from a Rhode Island number, it'll come to the BH Link. We also manage other lines for kids and callers under 18. But a good entry point is the 414-LINK line, or someone can stop into the link at 975 Waterman Avenue in East Providence if they feel they need help. We also work directly with our local first responders, so they have a relationship with us, and we're in addition to being a triage center, we're essentially an emergency department diversion center, and we're trying to really reallocate those resources to behavioral health professionals in a non-emergency room setting when those are the services that they need to try to alleviate some of that stress on those emergency department workers. So there are a number of ways to access the link, but certainly the number is the best and quickest way.
Yeah, Cliff, one of the things I shared with you as a former mayor, I work directly with our paramedics and our rescue, along with the fire and the police, and we could have a whole show just on the the work that they've done and the contributions that they have made, just like everyone on this panel has made to the state, but also how it wears on them as well. And I know that you have you've made an effort to do a program to kind of work with our front line, and I know I certainly haven't walked in their shoes, but I've watched very upfront the important work that our rescue, our fire, and our police provide to a community. So thank you for providing them with the place to bring people, but also for them to actually access if they're dealing with some of the stress and trauma that's impacting their lives.
Thanks. Well, the gratitude really belongs to all the workers at the BH Link and all the community mental health centers, and and Health and Human Services centers across the state. They've done really a tremendous job, and hopefully we continue to move in a direction that allows us to utilize our services more efficiently.
Great. Noah, please introduce yourselves. Thank you so much for being here tonight, and I'd love to kind of share with the people who are watching the type of efforts that you're putting in, and what has it meant to you, and also professionally over the last year.
I want to thank you, Lieutenant Governor, for inviting me to be part of the discussion. And I want to thank all the clinicians on the call. Really appreciate the work that you do. I am the only non-clinician here. And you may ask, well, what the heck are you doing on the call? And I will tell you that it's what we do here at Rhode Island Primary Care, in which I am the CEO, is we properly position all of our physician offices to be able to deliver high quality care to the community. Rhode Island Primary Care has a collection of just over 150 primary care providers. They're roughly a third internal medicine, a third family practice, and a third pediatrics. And what we do is collectively, we organize care with our many different offices. If I think about the 150 some odd providers, it probably shakes out to be about 65 offices. So the 65 offices and the over 150 clinicians work collaboratively so that we can leverage economies of scale and resources and really deliver to the community team-based care. A lot of people say, well, what does Rhode Island Primary Care do differently than a normal primary care practice does? How do you help them? And what we do is we put support around them, scaffolding, as I would call it. And within that scaffolding, you have nurse care managers, you have pharmacists, you have behavioral health clinicians, you have patient navigators, and all of these team members work collaboratively with doctors like Ryan so that they can deliver the highest quality care possible and make your healthcare experience hopefully one that is not as confusing as the healthcare system can be. And we really focus our efforts on our most highest risk patients, which are our most chronically ill patients, so that we can help them along their healthcare journey. And when a physician who can see them 2, 3, maybe 4 times a year needs to do more work, that's where we plug ourselves in collaboratively with doctors so that we can give that 7 days a week, 365-day care that you can't give as a clinician when you see that particular patient maybe 1, 2, 3, or 4 times. So that's what we do within our community. And in this particular year, it's been incredibly difficult. And I have to thank you, Lieutenant Governor, for the great work you've done on behalf of small business, because our providers are really small businesses. And you don't often think about a primary care office as a small business, but it truly is. And they've got a profit and loss statement. And when Rhode Island goes on pause, or when we went into that really incredibly beginning of the pandemic where the entire state stopped for almost 90 days, nobody was coming into the offices to be seen. And that's bad 2 ways. It's bad because if you need to be seen and you're not accessing care, whatever that condition is, it's going to be worse. And if you're a physician, really you pay your bills and your staff and you keep your office open because you see people on a regular basis. So our focus this particular year was to really keep our primary care physician offices in business, keep them financially solvent, make sure that the PPE, the protective equipment that was so difficult to come across, that we were able to secure that and to deliver it to them. And then we were able to also help work collaboratively with all of our practices, with our vast clinical staff, to go out to houses and to visit people where they were comfortable receiving care. And I think that helped us get through some of the most difficult times. But I can say as of now, we're still in a really difficult position because you can't get to everybody, given how big your staff may be. And invariably, you've got to get these people in to see their providers so that they can be guided through whatever their medical journey is. And if they don't come in, they could potentially go off the rail. It's costly to them in their own personal lives and costly, obviously, to the system at large.
Yeah, so Noah, thank you for mentioning that, because I do believe there's a direct connection in particular between our health and safety and the economy or our small businesses and the education piece. I think they're all very much connected. And, when we work in our own little spaces, we tend to think, okay, you don't maybe realize you're so focused on your work because it's so important that you don't, you're not, it's not your job to figure out how to make sure that, for instance, the local physician, the local dentist, the local chiropractor is treated, in a way where they can actually come out of this so that they can provide the services that we all need, coming down the line. So that's why I've been fighting so hard to be including those private practices as into the grant programs that I talked about. And, we're going to want to talk further because we've had the headline that millions of dollars have been out there to help these small businesses. And Commerce and Taxation, Division of Taxation have done a yeoman's work, just like everybody here and people you represent, to get dollars into those businesses. But there's millions of dollars that have not been awarded, millions of dollars that are still available. And if that's the good news for us right now is the new legislation allows those dollars to be rolled over into next year. So not only will it help the small business, it should help the healthcare community. It should help the education community because I think there's still unused dollars that we would have had to hit a hard deadline of December 30th. Today would have been the deadline to actually use that whole 1.25 billion. So on that particular piece, we're going to be laying out the argument to roll those dollars that were allocated to help small business, in this case, to actually include like a Restore Rhode Island 2 program that would include those medical offices that weren't allowed to participate in those grants the first time around, eye doctors and dentists and other physicians. That's an area that we can actually, work on and do better this time around, so that, I'll let you know about how we're working on that because back to Raquél's advocacy, it's so important right now to find the advocates to really address the needs of people who are in that community that you serve. So thank you for bringing that up, Noah. I'd like to just go back. This is one of the things that I'm working on right now is, I think I alluded it in my opening comments. I'll go back to my coaching days when I coached a lot of basketball, and I would always bring the team together towards the end of the game, and we might be up by a few points or we might be down by a few points, but I would always let them know that look at whoever puts the most intensity in right now in their effort is going to end up going to be on the victory side. And I see us right now in that space where we're worn down. Everybody in your communities that you provide the services that you provide, they've been really stressed out. With the time frames that they put in, from the nursing homes all the way down. I hear about the extra duties, the nurses and everybody else that's really putting. How do we dig down deep, knowing that we've got the vaccine and it isn't completely rolled out yet, but it is going to get rolled out, and we're going to do a good job in the state to get it to everybody. But how do we dig down deep and finish? And I'll excuse me for the sports analogy, but to finish the game in a way that we've done in the past. And I've been asking communities. I've been meeting with civic leaders and political leaders and medical leaders in all the different communities, Westerly, Cranston, and Center Falls. I just had the focus group with all of them, and I've been saying the same thing. Well, that's my question to you is, Raquél, you've expended all this energy to get to this point. How do we, get the thing across the finish line in a way where the virus is the opponent right now? That virus, and it spiked right around Thanksgiving and beyond in a real critical way, right? It really put us really at risk the way it was spiking. And so that's the opponent. The opponent was that intensity was increasing, and yet we're tired, but we got to dig down deep and figure out how to actually finish the effort. So thoughts on that? Give me just some thoughts on how, in your world, how do you help the nurses in a way where they can actually finish what they've started in a real, strong way? Because I know it's tough. I know it's very tough. People are tired. We can't let the fatigue,
Yeah, it is tough. I think in terms of healthcare providers that are on the front lines digging deep, what would help most is just support, either from each other, from the community, from resources, just making sure that's there. And I want to go back to the beginning of when everyone knew about the pandemic. We saw a lot of support for healthcare workers. There were cheers, there was free stuff, there was things like every day where people just loved on us and showed support. And as the pandemic kept going on and on and on, I feel we kind of forgot in a way that there's still people, not just healthcare workers, but frontline workers who still need that support that we were so ready to give everybody in the beginning. And that needs to continue on. That can't just stop. Mental support, emotional support is so important right now for everyone. But that's how healthcare workers are going to dig deep, by relying on community, by relying on each other, by resources, because otherwise it is exhausting. It's such a mental toll to be able to go into a hospital and think, like, what am I being exposed to? Never mind the fact that just being a nurse is hard to begin with. It's not easy to talk to sick patients. There's, of course, the really incredible moments of my job, but there's also the really devastating ones, and amplify that by 1,000 with this new pandemic. And that's what we're kind of facing. So I think in terms of healthcare workers, just increase support. But in terms of community and digging deep and just the general public, I personally think that all just goes back to education and making sure that that trust with healthcare providers, with nurses, is still maintained and doesn't go away. I felt like somewhere along the way it sort of did, with misinformation and not knowing who to turn to, or just not knowing what's going on. But that really goes back to education, making sure, especially the small communities, the minority communities that don't get exposed to regular information, people that don't have access to news stations, internet, TV, whatever it is, those are the most important communities, because it's really easy for myself, who has a plethora of information available to me, to do the research, but it's the people that don't have that privilege that really need that education piece. So I think it's those two factors that's really going to help.
Yeah, and Raquél, thank you for sharing that, because this is where we are right now. We have the solutions are in front of us, but you know, I'm hearing when I'm going to these these focus groups that I've been having, and the media is there because we want them there, because I think that this is a grassroots education strategy, as you said, empowering them to understand what they can do to keep their community safe. And what you just said is so, you know, it struck me, and the fact that the rallying that was there that kind of created the energy. You know, we need to maintain that, especially as we're getting, you know, towards the end of the you know, this pandemic. This is not the time to it's not relaxed. It's not the time to get, you know, so tired or so fatigued that you can't finish it as strongly as we need to. And what you just said would help motivate, right? That would help provide the motivation, that the appreciation that we need to continue to give to the people who are actually on the front lines. Thanks for sharing that. That was really good. Very, very helpful. I think that people are watching and listening. I'm talking about, you know, let's get the grassroots. Let's get all these civic. We're talking about the chorus in Westerly and the churches in Westerly and all these other communities, and what role they can play. So they need to hear that message that you just said. Brian, tell us how we get over across the finish line in the world that you live in, and not let the fatigue of a virus that has, you know, been very taxing on us, both physically and mentally. You know, tell us what your perspective is and what you would see that, you know, could be done to help, you know, provide that extra burst of energy that would help us, you know, finish this thing strong.
Sure, Lieutenant Governor, and I agree with everything Raquél said. I think the biggest key going forward is the vaccine. I think the vaccine, I think education on the vaccine, getting people comfortable with the vaccine. You know, I can tell you I took my first vaccine about 2 weeks ago. all I saw was joy in the room. The nurses, the doctors, everybody who got a shot, there was a big grin on their face, and you can just feel the exhalation. It was just a relief knowing that, they can go forward in their career, while this is still going on, and have some form of protection. And as we take the vaccine, the public needs to see that the vaccine's safe, and they need to take the vaccine. I encourage the public to call their physician at this point. I think there's a lot of misinformation on the vaccine. I believe you're going to touch on that a little bit this evening. The media, where are they getting their sources? But call your primary care doctor. I mean, we've been on these meetings with the Department of Health. I'm on meetings with the CDC. I'm giving out the vaccine at the Northern Pod in 2 weeks. Call your doctor and get correct information on the vaccine, and ask them any question. No question is too silly. The vaccine gets us over the finish line. So whatever it takes to people to get into that stretch run, we can do that with the vaccine.
Yeah. And how do we keep, how do we keep people safe as we go along? How do we reinforce that you can't let the fatigue of this, you're isolating yourself in some cases, and it gets very, very tiring, and people can let that guard down. And what's your advice there, doctor, in terms of, continually talking to the people? You just said, call your physicians and that type of thing. But how do we overcome that fatigue in any particular community?
Sure. And I think Cliff's going to have a lot to add here, but from the beginning, patients were getting scared and afraid to leave their house. And, at the beginning, my advice to patients was always to get outside, get some fresh air, change the channel. There's no reason to watch the news all day. I think somewhere over the summer when the cases got down, I think we got a little bit lackadaisical maybe. And by the fall, the cases started to spike again. And I think that's where the COVID fatigue started to come in. And, I do anticipate a spike after Christmas and New Year's, and it's to be expected. But we've got to just keep doing what you're doing. The answer's in front of you. We just have to mask a little bit longer, quarantine a little bit longer. It's okay. We have to tell people to keep in touch with their loved ones. I mean, maybe at the beginning we couldn't figure out how to talk to your mother in a nursing home or your friend in a hospital. A lot of those answers have presented themselves. Telemedicine is something we haven't talked about tonight. I think people felt isolated at home. Isolation was a big factor with a lot of the anxious and depressed patients who called me in my office early on and during the whole pandemic. Telemedicine was a fantastic addition in Rhode Island. It really wasn't a big player here. I believe the governor signed an executive order to force the insurers to participate, and it's just been great. It gave the patients an outlet. It gave them a way to reach out to us and, have their questions answered, get some form of care. Telemedicine's here to stay, and this was the beginning, and I think that's a great way to open up the world. And I think as the world opens up for them in one piece at a time, I think that a lot of that angst will dissipate, and I think they'll be able to get over the finish line.
Yeah, thanks, Doc. I think that's so important. Cliff, so I liken this community spirit that I feel as though that we can really cultivate and make sure the intensity of against the opponent, which is the virus, that we're able to maintain a high level of intensity in terms of attacking that. And I liken it to 9/11. So when I was a mayor for 9 months in 2000. When 9/11 hit, and I saw a community organically come together to really address and to fight, back on that attack, that terrorism attack that we had. And, I reached out to the clergy and asked them to, for their advice, and all the clergy from all the different, religious, sectors came together, had a prayer vigil in the town that actually continued for 5 years beyond 9/11 with the community. And then, the candles were lit. The people said, I'm going to raise a little bit of money to help those families that were impacted. I see this as a similar stage right now, is that, to find that community spirit. And you're working with many people that probably never thought that they would be on the brink of, the difficulties they're dealing with, whether it's economically or the stress on them individually, mentally. Tell us, give us your thought, because the most important thing to do is in the preventative strategy, so that we don't have to address some of the things that you have to, you're working with. But give us your thought on how you create that community spirit and bring it down to people that you're experiencing with that are stressed right now, that are dealing with real issues. How do we help, build up that community spirit to do what Raquél was talking about in terms of just, strong grassroots type support for the individuals that you're working with right now?
Yeah, I mean, I think that's extremely important. That's what's a little bit different. I mean, I think there are a lot of similarities with 9/11 in that we're experiencing this new sort of collective trauma, and we've never, I don't believe very many people alive have ever experienced it before. We don't know quite what to do with it, and I think that leaves a lot of unresolved anxiety and stress, and can lead to depression for many folks. It can, and it has led to increased, bad habits like increasing drinking or increasing smoking or other habits, that are similar and destructive. I think that what the challenge that people have here is they have not been able to turn to each other, right? Because they haven't been able to see each other as much. They haven't been able to connect with each other as much. And I think it's important that, as you said, we rally collectively to that end, and to try to, get as much, enthusiasm as you can to get to the end here. It's been a difficult year for everyone. And you do that, I think, by accessing the care that's out there that you need, and try to really understand that, we're all going through this. There's no shame in seeking out mental health services. There's no shame in reaching out to friends and family, and there's no shame in reaching out to a therapist or a doctor for additional help, because those services are there. They're available to you. And, as we just discussed, telehealth services have really opened up a whole new avenue there. And that maybe is one of the positives getting us through this and beyond, that we've really kind of bolstered our ability to get to people who have transportation issues, who don't have access to education, who don't have access to healthcare the same way that some other folks do. We've really figured out very creative ways to do that, including telehealth, including community outreach. And so, my message would be, to not be afraid to seek help, that this is something that everyone's going through, and there's absolutely no shame in seeking help. And it may be the thing that helps you get through this as healthy as possible.
Yeah. So the people, the overall majority of the people who live in our state are working their way through it, right? In a lot of ways, they're impacted in ways, but rallying behind, and figuring out a way to help those who are, as I explain a lot of times, even in the business sense, a lot of people were squarely in the middle of the table when this all started, whether it's mentally or physically, economically, and many have drifted to the edge just because of the circumstances. And those who are kind of close to falling over the edge, that's who you're referring to right now, right, Cliff? I mean, in terms of seek out the help and seek out the teleconferencing.
I think people come from a broad range of perspectives, as we all know, and so there are people who are frustrated because they're terrified of the pandemic, and there are people who maybe don't think much about the pandemic and are frustrated because their lives have been, thrown into disarray in some way because of the pandemic, and so there are all kinds of reasons, but I think, again, what we all have in common is everyone's life has been disrupted by this, and so we are, as humans, we need to turn to other humans. There's really very little that can substitute that support from others in order to get through this.
Thanks, Cliff. And Noah, the same line of thought in terms of, how do we dig deep right now in terms of the intensity that you need to kind of finish off, an experience like we've had. This is like 9-10 months at it, and we still got several months to go before we get out of it. But how do we dig deep in your perspective in terms of really matching that intensity so that we prevent future spikes, so that we control the that infection rates to a degree as we get into the vaccines, and at the same time that's going to allow the practices that you talked about to see more patients, the restaurants to serve more dinners, the fitness clubs to have more fitness classes. So what's your thought on that in terms of digging deep, and how do we do that in a way that we actually can be successful?
Well, I'd say, this time of year, I think about a few things. I think about what I'm thankful for. Here within my world, I'm thankful that I'm in healthcare and we can make a difference, all of us on this panel and all our respective organizations. I'm thankful for the teams that we have out there, the pharmacists, the nurse care managers, the behavioral health clinicians. Really at this time, because as Brian spoke to earlier, the vaccine becoming more readily available, there's a light at the end of the tunnel. And I think just that in itself has created a new enthusiasm and energy around getting and digging deep into whatever that last gear is that we have to make our way through this. Yeah. I think that we finally feel as though there is a light. We see it. We know it's a little further away than we would like it to be, but we're chasing it. And I think that enthusiasm in really supporting one another, our interdisciplinary teams working together with the clinicians, with the primary care providers, I think have created a brand new energy that at least I feel within our organization and association. And that's carrying us through now. For me, I really feel the tailwind. And I think Dr. K may be able to talk about this, maybe even more detail than I'm able to. But we feel it. I can feel it around the office. And one other thing I'm also thankful for, given all the challenges that, been over this last year with the pandemic, is I think telemedicine's been talked about, and how there's a new medium in which people are more comfortable. We made that cultural shift so much more quickly than we ever thought we could. That's a great thing. And I think that we also learned a lot about our members because we became more intimate with them, going out to their houses, going to their environments. So we learned much more about their challenges, whether it be food insecurity, whether it be housing issues, whether it be around mental health, anxiety, or depression. So we got much closer to the member than we ever had before out of necessity. And I think that in turn has also revitalized us and made us think about innovative programming that we'll take out of this and then continue to implement moving forward. Because although it did help us during this most difficult time, we know it will help our members, from here moving forward. So Dr. K, I don't know how you feel about the enthusiasm that I feel as it relates to the clinicians because of the light at the end of the tunnel.
Oh, I completely agree, Noah. that light's right in front of us, and we need to show that light to everybody. We need to show it to the public. We need the public to be confident in the vaccines, confident to go to their doctor's offices. The number of patients who really haven't gone to a provider in the last year is astronomical. I'm weary that if people have neglected colonoscopies, mammograms, routine health, diabetic care, the stuff we do day in and day out, I'm afraid what kind of a different type of healthcare problem is waiting for us after the pandemic. My messages going forward here would be to encourage people to go to their doctor. Definitely encourage people to, if you're ill, to get tested. You talk about keeping your foot on the pedal. There's the biggest foot on the pedal. A lot of the patients who have called, a lot of cases in the last month, everybody did. And a lot of the patients called and kind of blew it off. This is my seasonal allergies. This is my usual sinus infection. It took a lot of urging now to get them tested. In March, everybody was scared and got tested when we asked them to. Now it was a little bit of a nudge. And I'll be honest with you, most of them were positive. So let's find these cases and get them isolated and let's get across the finish line safely. And the last message is, please get the vaccine. Please get the vaccine. We've got 2 safe vaccines, a third one that was approved today in England that I expect will apply for emergency FDA approval, and then a 4th one that's right around the corner, the end of January. They're effective, they're safe, and please, don't be afraid to call the Rhode Island Department of Health, call your primary care doctor, call any of us, call Rhode Island Primary Care, and hook you up with somebody like, I'd be happy to answer questions through them about the vaccine. We've been on every meeting you can imagine about the vaccine. So, we need to educate the public. Let's do it. Let's get across the finish line.
Yeah, I think that's, we're all, I got to admit, that in our own ways, we're all, tired, right? I mean, the efforts that have been put in have been extraordinary. And, taking your advice there, Doc, and Noah, see that light of the tunnel and find that, that extra energy from a community where, the ground up to support, as you mentioned, with the Department of Health and others. They've been extraordinarily, working hard, right? And so I think everybody's is impacted by a certain level of fatigue, but how do we, do what Cliff said is, become a community that says, oh no, we're carrying one another right across this finishing line. And we're going to do whatever it takes to keep us safe as we, get to that spot. So, I just wanted to thank everybody. We're coming up on the hour. I can't even believe it. But Raquél, last thoughts, I'm sure that things are going through your head. We'll just go around and give everybody a last thought on this. And I know we can't cover everything, but give us your perspective on the discussion we've had, and also your own personal thinking on what's going to happen right now for us.
Yeah, I guess my last thoughts are just that of gratitude. I'm really thankful to be on this panel, like I said in the beginning, but to also listen to everyone's thoughts. But I'm thankful to the healthcare workers that are in the bigger hospitals in our state or just around the country that are really going through the trenches of this pandemic. It's been a hard year for everyone. And it's a huge mental toll, like I said, to go into work and think about not only what your responsibilities are on a day-to-day basis as a healthcare worker, but then with going through it in a pandemic. But I guess my message to nurses especially is just don't be afraid to share your perspective and your story. I think right now that's really important and impactful. And that goes back to what we were saying with education. It's important to empower people through experiences and stories. And what better way to let people know what's going on than through the best storytellers there are right now? And that's doctors, nurses, any type of healthcare provider, healthcare team, support. So yeah, that's my message. And I think just every person goes through their own experience right now when you work in a pandemic. I myself work in a specialty hospital, so I'm seeing a totally different population of people come in. I'm seeing a total different number of COVID cases than what Rhode Island Hospital might be seeing, who has a huge ER and triage. And that's really important when people go online and see information or do get perspectives of frontline workers, is to remember where they're working, what that population looks like, and what the city and neighborhood looks like too, because my perspective is going to be totally different from someone else's. But we should all remember the bigger problems here, and it's to keep going forward and to pull through and remember that there's light at the end of this tunnel, but to also trust in the people who are experiencing it the most right now.
Yeah, I think the empathy issue is really there. That came out front and center in some of these focus groups that I'm having, with whoever it might be the clergy, but we gotta, not be judgmental. People have different, needs. They have different, thoughts about it, but the safety issue is like front and center right now, and the vaccine as well. So, Cliff, any last words for you? And then I'll go to Brian and then I'll end up with Noah.
I will be very brief and just say that if you need help, someone who needs help, please reach out to your physician or reach out to 414-LINK. And there are providers out there who can help guide you in the right direction and help to provide you the help that you need.
Thanks. Doc?
Sure. One last thought that I didn't get out before was, one lesson going forward. Maybe, when this is over, we don't know when the next virus or when the next problem is going to happen. Don't go to work sick. Don't drop off your child to school sick. I think with the advent of some of the Zoom calls like this one, I think kids can distance learn. People can be productive for their job from home. And there's no reason to expose the public to illness going forward. I think we might have, that might be another big plus out of this.
Yeah, we'll get. I can't wait to get to that. We'll have you back to have a lessons learned. After we, dig down deep and finish this off strong. I think the lessons learned is going to be a very important one to discussion to have, and that time will come. Noah, last thoughts of yourself, please.
Last thoughts are: do not put off care that you need to receive today for tomorrow, please. There are protocols in place that are taking care of everything, so you remain healthy, you remain safe. And what we don't want to do is to have you not access care that's paramount to your future and your wellness. Call your doctor, have those conversations. It's not a leap of faith. There's a lot of money that's been invested to keep you safe. Get in there, receive the care that you need and you deserve, so that you can come out the other end of this feeling as well, hopefully, as you did when it started.
Thank you, and thank you to everybody that came on today and shared the information. Our office is available. You can call us. It's email addresses down there. Especially if you're in need of some level of help, we can help steer you into the panel here and beyond that. And I would also just say that the advocacy that you present, that you all provide, really critical. And there's a new stimulus amount of dollars, resources. So it's a thank you, but it's also a thank you means that the proper resources are applied in the right places as well, because that's the decision making that needs to be made in the state level and the local level. So it's that advocacy that you provide, and then it's the resources that advocacy brings your way. So keep advocating for this. The safety issues that you work on, and please express my thanks to all your colleagues and all your associates for the work that you do. Thank you so much, and let's have a safe, healthy, and peaceful New Year, right?
Yes.
Thank you.
Absolutely.
Thank
you.
Happy New Year.
Happy New Year.
Yep.
Happy New Year.
Right back at all of you. Thank you. Yeah, so that's pretty powerful stuff there. I mean, you've got, that represents a sampling of the thousands of people that are on the front lines that we need the support. And you heard Raquél talk about, dig deep. We've said thank you many times, but this is the time to really double down on that and to the appreciation level of those who are helping us on the safety issues. Very important right now. So I really appreciate everybody coming in on this community conversation. If you have some thoughts or ideas about what was discussed tonight, let us know. And especially as we kind of get into this, let's start digging really deep. We, as a community, I know I've seen it. I know it can be done. And this is the time to really, help everybody across that finish line that we're all seeking, that space where we're safe. Our economy is supporting our families in a way where some of the stresses and that go through because of economic challenges. Our schools are vibrating again, and as the doc said, it's going to be great to have that conversation about lessons learned, about how we're going to become stronger as communities, 39 cities and towns, and I've always said it over and over again. Every community is important, and the communities that make up the communities are important. And that notion about, thinking about lessons learned, about how we actually are stronger and safer, and we have more opportunity for the people who live in the state of Rhode Island. That's going to be our end goal, but we got to get across that finish line first. So dig deep. Let's go. Let's build it as a community. Talk to our offices if you have some thoughts on how to make that happen. Happy New Year to everybody. Healthy, and peaceful. That's the plan. Healthy and peaceful, and then we'll take care of making this state this great place that it is for everybody to live. Let's come together as a community and get it done. Let's finish it off. Thank you so much.